We're going to start with antigen tests. Antigen tests are now available to be sent to each address across the country. So let's begin with these at-home, easy-to-use tests. They are called antigen tests or rapid tests, and they are different than our PCR tests because they test if someone is contagious at the time of the test. So we're going to talk through the specifics of what that actually means. So we're going to start with Dr. Kraft. What are these tests actually measuring?
Right. So we don't know exactly what each one is actually measuring because that is actually proprietary for each of the companies that have made these tests. And for a list of these tests and their sensitivity and information, you can go to the CDC website and look up antigen testing, and it'll give you a very long list of what is approved under EUA. But most of them are detecting sort of the antigen, which is like sort of a piece of the virus that's shedding or that's created by the cell as the virus has infected the cell. And so it's sort of like a piece of the virus that is on the outside of the virus usually. So like the nucleocapsid or other parts of the virus. There's also some tests that detect more than one part of the virus, which is going to be very important as we talk further about how these work under different variants. But most of them are detecting sort of the antigen, which is like sort of a piece of the virus that's shedding or that's created by the cell as the virus has infected the cell. And so it's sort of like a piece of the virus that is on the outside of the virus usually. So like the nucleocapsid or other parts of the virus. There's also some tests that detect more than one part of the virus, which is going to be very important as we talk further about how these work under different variants.
Yeah, and they do work a little bit differently under different variants. And we're going to get to some concern that was originally out there about whether or not they worked during Omicron. As we stick with how to use these tests, and I know you and I both have some to show, if I have a known exposure, when am I best to use my antigen test that I have at home?
Right. So I don't think that in general for exposures, this is a great test. So I think it's something if you're not having symptoms to use these types of tests, you have to make sure we're sort of in a peak time, which we are right now, and it's okay to use it at that time. But otherwise, you may not get the results that you want if you're just testing yourself when you don't have symptoms. So I think for exposure and no symptoms, sometimes that's best to go somewhere and get a PCR test so you can be absolutely sure that you don't have the virus.
So antigen tests at home, they have a more narrow window where we want to use them, but that window is perhaps slightly better if you're symptomatic. Let's compare them to a PCR test, which is really the gold standard and what we have all been using for several years now. So by contrast, PCR tests look for genetic evidence of the COVID-19 in a sample. So how does this give us different information?
Right. So what PCR does, and there was a Nobel Prize around PCR, so it's pretty interesting if you want some nighttime reading, is that it takes that genetic material and it looks specifically for it with something called primers. And when it finds that, then it amplifies that up. So that's why we call them more sensitive, because it can actually detect sort of that needle in the haystack. So that's sort of what I call PCR test. That's the needle in the haystack test. So you can find it. You can also be very, very, very sure that you don't have COVID if you have a negative PCR test, because it is looking sort of very, very deeply in that sample.